board-certified OB/GYN, Dr. Kecia Gaither, and she is a maternal fetal medicine physician. Welcome, Dr. Gaither.
Good morning, Miss Linton. Thank you so much for having me.
And please, I'm Maggie.
And I'm Kecia.
All right, Kecia, you got it. Listen, you've had quite a career, and I know your focus is really on all pregnant women having a really healthy pregnancy. But
Absolutely.
Sometimes that diabetes can really kick up and cause a lot of problems, and gestational diabetes only done when it's pregnant. There's a woman that goes to my church. Her past 3 children, and she's got 3. The diabetes has kicked up, and as soon as she has the babies, they're done.
Yeah.
Crazy, huh?
That can happen.
So talk about why it happens.
Well, I think there are a lot of things that go into it. Let's talk about the different types of diabetes. You have your pregestational diabetes, which is diabetes before you even get pregnant, which has its whole host of issues that go along with that. And then you have your gestational diabetes, which presents itself when you become pregnant. Now, when you're pregnant, your placenta puts out a lot of hormones, and some of those hormones induce a diabetic state. So if you are already on the edge or, say, the brink of having poor glucose control, being pregnant and having that placenta grow predisposes you to develop gestational diabetes. In the United States, every pregnant woman is tested between 24 to 28 weeks of pregnancy and earlier if they have a history, say, of having large babies, if they have a history of having gestational diabetes in the past, if they're obese, if they're African American, if they're Indian. Those are all some risk factors which give you an increased risk of having gestational diabetes.
Which is why it is so important, and I do mean so important, for you to go to a doctor regularly. As soon as you find out, you need to be checked in with somebody.
Absolutely. Absolutely. Can't emphasize that enough. And if you are a pregestational diabetic, it is even more important because if your blood sugar is markedly elevated during the conceptual period, that can have some bad effects for the developing fetus. As a human, everything that you have is developed within that first 6-week period of pregnancy, and there are certain abnormalities, not genetic, but congenital abnormalities that can develop if you're poorly controlled and diabetic and you have just conceived. Babies can have defects along their brains and spinal cord. They can have defects with their heart, and they can have defects along the lower limbs, basically forming what's known as a mermaid baby. So these are things that can all be potentially negated if the mother gets herself in good control prior to even conceiving.
What is a mermaid baby? I have never heard that term.
Well, the official name of it is called cervinimalia. And basically what happens is the lower legs fuse into what looks like a mermaid's tail.
Wow.
And those 3 things that I mentioned, the lower limb abnormalities, the heart abnormalities, and the brain and spinal cord abnormalities are known as diabetic embryopathy, meaning that because of the diabetes being so out of control, it interferes with the normal development of the embryo. And so those are the 3 things that we commonly see among pregestational diabetic women who are poorly controlled prior to conceiving.
Wow. I had never heard about this at all. And you find that so many African American women, like you said, are so greatly affected by this. And part of it is because in many cases they don't even know about their diabetes. It may be on the early stages. Also,
Correct.
A lot of it by not being really taken care of themselves.
Correct. And also genetics. If you have a strong family history of diabetes running in your family, like your mom, your grandmom, your aunt, your sister, there is a high likelihood that you yourself probably will have or subsequently develop it.
Wow. Okay. Folks, if anybody has any questions or comments, you're definitely welcome to call. We've got someone who knows what she's talking about. And the number, of course, is 866-801-8255. Once again, that's 866-801-8255. We're talking with board-certified OBGYN